Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McRae, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, well, in keeping with our pledge, really, to try to support the Freedom of Choice in Cancer Therapy Group, their featured speaker this month, who'll be up there on the 19th, that'll be this Thursday, is none other than a very famous chiropractic physician who's been, well, he's been all over the United States. He's certainly been in our area, taken a lot of our clinicians and trained them in an art, a medical art, referred to as CRA. Of course, that stands for Contact Reflex Analysis, and Dr. Richard Veresedaal is going to be our guest today to discuss about exactly what CRA is and is all about, and maybe tantalize you a bit, stimulate you a bit to come and visit him up at the Freedom of Choice in Cancer Therapy Group meeting this coming Thursday. Now, a lot about this meeting is the same, but some about this meeting is different. It's third Thursday, so that's in keeping with the tradition. It is at 7 o'clock, so that also is likewise. But the place has changed, folks. It's not going to be at the Day's Inn. Slightly past there, just beyond the Day's Inn, there's a right turn you make. Name of the road? Littman Road. Turn right on to Littman, go past the shopping center. When Littman comes to a T, turn right, turn to the left at that particular point, and you'll be right at the South Butler Fire Hall. And the address for those of you who are GPS inclined, 174 Old Plank Road. 7 o'clock now, but the venue is not, I repeat, not at the Day's Inn. It's going to be at the South Butler Fire Hall. 7 o'clock, Dr. Richard Veresedaal is the guest, and he's going to be our featured speaker today, our featured guest today, trying to give you an idea of what CRA is all about, and hopefully encourage you to come on up and visit him. So we're going to have a lot of fun. Never really met Dr. Veresedaal, certainly known so much about him, and waiting for the opportunity to at least meet him via the airwaves this morning. Now, our schedule will march on. May is moving along very feverishly. I will say a week from now, we're going to get Cass to come back. Now, Cass, as you heard him on our show on last Wednesday, was bringing in this concept of radioactive exposures. Really would have a lot to do with the incident over Japan with the power plants, and literally the places blew up, and we followed that very closely and are still following it today, but you have not heard much about it. Cass picked up the gauntlet as he normally does, and he's quite concerned about it, and we had our initial discussions with Cass on Wednesday. During that discussion, he just mentioned just a moment worth of something that really triggered a response in my memory when he talked about the X-ray exposure, the medical X-ray exposure issue. And this is something that we have really spent some time on over the many, many months and years. And it appears that Cass, in keeping with how to do a preventative before you should ever need a medical procedure that requires the use of radioactivity, or those who may have been exposed to multiple procedures where radioactive isotopes were used. We're going to be talking about medical X-ray exposures on the 23rd And I'm looking forward to giving you an opportunity, folks, to have a plan. I mean, you're going to require, you're going to need to have these X-ray procedures. You'll of course want to minimize them, but as medical science needs to move toward diagnoses and treatment responses, it's just part and parcel to what it gets done. What you don't want to have is multiple exposures, unnecessary exposures. And when you have to have a legitimate exposure, and you'll know when that is, what to do about that in terms of preparing for it, as well as taking care of the aftermath from it, is what I hope to have our discussion about on the 23rd with Dr. Cass Ingram. On the 25th, next Wednesday, Stuart Tomp is going to be our guest. Stuart has been here many times before. I met him when he came to Pittsburgh once. He represents Nordic Naturals, this very famous company making essential fatty acids in the form of fish oils. But he's going to be talking to us about surf or turf. Not surf and turf, surf or turf, which is healthier, and I think you can see where it's going from there. We'll have him as our featured speaker, featured guest on the 25th. Then, as we move into the month of June, Susan Smith-Jones is going to be our guest the very first day of the first of June. And for those of you, David, who are David Brownstein devotees, of course, we just had David on our show on Friday, and as usual, off air, I try to encourage him. David, can we get you back? Would you mind coming back on the show? He has so much to offer. He has consented to return, but it's all the way out in the month of July, so we're a little far away from it. But I just wanted to let you know that David will be returning in the month of July, and he will have a new topic. It'll be a new book. Now, many of you know about this book, because I certainly remember when it first came out. He alluded to the writing of this book in his first book called Iodine. But how about this for a title, and I think it says it all: Salt Your Way to Health. Finally confronting the salt scare, which I believe we're all entrenched in, and getting a perspective from someone you're comfortable with may be able to give you a different perspective entirely. Of course, that's a couple months away, just to let you know. Now, we're just still cleaning up from our eye treatment seminar, which was held here last week. All participants have returned home. The last thing that they were issued, which will sort of enable me to wrap up where we stand with their particular cases, is going to be their heavy metal testing. Now, we issued them a heavy metal testing kit from Doctor's Data. That's one of the two main labs in the country that does heavy metal testing. Another one's called Great Smoky's Lab, but these folks have all returned home, all having an improvement in their vision that was documentable in the first 3 days of this treatment seminar. So they leave us on Wednesday with improvements and then given an assignment to continue their treatment at home. I'll be putting together a final report on them once I get the result from their heavy metal testing and to find out what metals are on board. This, of course, is in keeping with the triad. We call it the treatment triad, and I think you certainly are aware of this triad, no matter who it is that you're pursuing or following in terms of your own treatment. If you've acquired the knowledge over time, I'm going to tell you that it more than likely fits into 3 different treatment components. And the triad involves getting the circulatory system up and running well enough so that you can perfuse all of your organs, circulatory perfusion, the ability to get a blood supply to whatever portions of the body that are in question. All parts of the body, of course, would benefit from this. But if you're talking about rescue of a gland, and if in this case we're talking about the eye, there are certain procedures that would be beneficial to get that eye perfusion going. The second component of the triad would be the use of nutrients in order to correct any deficiency state which has accrued over the years, and certainly with eye conditions of macular degeneration, cataract formation, glaucoma. These are not disorders of the young. These are disorders in the aged. And so what this is a lifetime worth of deficiency finally logging in before your departure, if you know what I mean by the word departure. This is occurring in an older population. The third component, which is in keeping with just having mentioned a moment ago that we were going to be doing heavy metals testing on all these patients, is also a good guide that you've always followed and that we follow here in completing this triad, which has to do with heavy metal toxicity. Toxins in general, but in specific the heavy metals, would certainly also accrue over many, many years and ultimately will weigh in and provoke dysfunction, improper functioning of any organ, any highly sophisticated group of cells. When it's finally, I guess the word would be gunked up with enough metals or enough toxic agents, these cells will not function correctly and pathology will result. So in keeping with that triad, which this concept at least was something driven, I hope, home over and over again with the patients who were involved in the eye treatment seminar, the message for the listener to this show is, hey, no matter what you're doing, you're more than likely following one of those three prongs, and those are very solid avenues to pursue. They will yield a tremendous improvement in whatever pathologies you might need to be working on, certainly having nothing to do with the eye alone, and having everything to do with the triad of a good alternative treatment program, which should consist of reperfusing an area, bringing nutrients to an area and correcting deficiencies, and third, removing toxins from that area and detoxification process, especially the heavy metals. So more on that as I get those results back. I'll share them with you many times now. We have done this heavy metals testing, and I guess the common four of the metals that are usually found when we give a provocation agent, such as, there are many of them, but you have to give a chelating substance in order to pull out these heavy metal toxins from the tissues, which is where they are firmly entrenched and established. Something must pull them from the tissues into the blood, and then once in the blood, a one pass through the kidneys will allow the kidneys to literally remove the substance. And so by analyzing the urine, after you've given a provocative agent, a substance that will pull from tissue, you can then be not only subjective, but objective about what the metals are and what the quantity of metals are. So more on that subject as we move on. Let's do this. Take a short break. And in the interim, we'll go and find and locate our good friend, Dr. Richard Veresedaal. We're going to be talking about something he's become very much associated with, contact reflex analysis, by Dr. Richard Veresedaal on our return.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how frequently you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray.
Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly expressing your faith, let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call us now, 1-800-442-3793.
I just tried and I get nothing, and I'm on the air, so it's very difficult for me to pursue it. I'm going to give you a phone number that please call. Once you find him and you locate him, I'll give you a number to give to him. It's 412-825-6262. Okay. Hey, good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on this Monday version of the show. Our guest today is intended to be, and we will locate him, I'm pretty sure, Dr. Richard Veresedaal. I've spoken to his office. They're trying to feverishly track him down. We've given him the phone number to our control room, so Dick, be ready. They'll be calling you, and so we'll just wait and hear that big double ping whenever they've identified Dr. Veresedaal. We'll take some time as we await him to allow you to come on in and maybe set the agenda yourself. Anything on your mind is okay with me. Any questions you may have while we are in this holding pattern will be okay, and it have to do with anything on your mind, whatsoever. In keeping with the conversation we were just having a second ago, and I think it is time well spent. An analysis of what gets done by literally all the practitioners, well-intended practitioners that you have come to rely on. If you tend to examine what it is that is being done by those practitioners to help you, to assist you, you'll find that those 3 niches that I mentioned are absolutely better be. Not that they have to be, but and that they are. But as you examine your treatment programs, I would strongly encourage you to be checking to make certain that those 3 prongs, those 3 components of that triad are met. And so we'll have more on that subject. I think maybe we do have our guest patched into us right now. Dr. Veresedaal, are you with us?
I'm with you. It's a beautiful sunny day today here in Michigan, and thank you for inviting me on your program.
Well, Dr. Veresedaal, I'm glad we got the glitch worked out. However that occurred, that's fine with me. I'm glad you're with us right now. I didn't have the opportunity to really introduce you properly. Let me take a moment. I'm sitting in front of a very lengthy bio, and I promise that I won't read the entire thing. But I think to set the stage, Dr. Veresedaal, for our listeners, and really to get acquainted with you, those who may not know you, many of my listeners already do, but you are, as the bio says, a master chiropractor, studied under and mentored by B.J. Palmer. Certifications, a couple of them, diploma in American Clinical Board of Nutrition, also in Integrated Alternative Medicine. You've been on the adjunctive faculties of 3 chiropractic universities. You received many accolades, many awards. The list goes on and on and on. But you are most tied to a topic that you are coming to Pittsburgh to discuss. We'll get to that in just a moment. Let's say finally now, welcome to Pittsburgh, at least by airways alone. And it's a pleasure to have you on board this morning, sir.
Well, thank you. Yesterday I was with a big group of 2,000 doctors in Kalamazoo, Michigan, speaking to them on health and wellness and on this generation of people. And we certainly had a great time and enjoyed mixing with doctors of all professions, by the way, medical doctors and chiropractors and nurses and massage therapists and people just interested really in helping people get well and live long and live strong. And absolutely, this is what doctors do. They're healers, they're counselors, they're advisors, they're in your family, they work with you, they bless you, they help to heal you. And so what would you like to talk about today?
Well, certainly you are very much associated with a particular technique. One, and I don't think I've ever had the pleasure of meeting you personally, but you certainly have traveled around the Pennsylvania region. You're very well known to many alternative medical practitioners from a skill that you either initiated or refined called CRA. Could you talk to us a bit about what CRA is, keeping in mind, of course, that you don't want to give away the story. You've got a whole group of folks that are willing to come up to see you on Thursday evening at our Freedom of Choice in Cancer Therapy group. You're the featured speaker on Thursday evening, so I know you're going to be coming to Pennsylvania once again. But in keeping with enticing the public to come listen to you, tell us a bit about what is CRA?
Well, CRA for short means contact reflex analysis. Our bodies are full of reflexes. If you study acupuncture, there are thousands of reflexes on the body. And many, many years ago, probably 35, 40 years ago, I worked with a very astute medical doctor in Michigan here that was highly degreed, well known in Grand Rapids, Michigan. He was a researcher, a scientist, a doctor, a healer, a surgeon, psychiatrist, family doctor. He was everything in one. And he happened to be my mother's medical doctor, and I was just a young doctor at that time, and he decided to work with me medically and chiropractically and with all his other friends out there who were dentists and nurses and people that were hematologists, and we decided to research with several thousand people. In fact, with 8,000 people. We worked at the University of Michigan, University of Arizona, and we literally used his work and my work and everybody else's work, and we called that the Tri-Stage Research Group. And we literally developed a method of testing the body through the acupuncture points, which we called contact reflexes. And so we took these reflexes and we figured out the small group of reflexes that fed the systems of the body. We have 5 systems in the body. And these 5 systems include circulatory system, immune system, nervous system, digestive system, and endocrine system, which is your hormone system. And we developed a system that we could literally examine just through these reflexes all these different parts of the body and analyze them and figure out where the root cause of people's problems was. And it's amazing. You could have a heart that was just very irregular just because your thyroid wasn't working, or you could have a heart that was racing because your adrenaline gland wasn't working, wasn't getting enough adrenaline. And you could be depressed because your thyroid wasn't working, and so on. We found all these different rationales and reasons why the human heart was irregular or struggling every day to get through life, because this is where we live. We live in the human heart. And when the heart is not happy, then other organs have to give their life to keep the heart happy. So we called this contact reflex analysis. We would contact these reflexes with our fingers, test them, and we soon found out that every organ and every system and every cell had a frequency and had a pulse. Just like you have a pulse at 72 beats per minute, each one of these organs and cells had pulses. And we would check these pulses and find out if they were irregular, they were low, or they were too high, that we had to balance them. And so through chiropractic adjustments, through medical means, doctors used some great drugs, and through great nutrition and meditation, we had clergy on board. When clergy would pray over these people, we would see that these people would get well. When we would see massage therapists massage these people, use beautiful essential oils on these people. These nerves that come down, these systems that go back to normal. So veterinarians would be in our group, and they would find out with animals, and when they use nutrition, they use oils on animals, animals would get well. And so over a period of 50 years now, we've determined various things that would help people get well. I got together with Dr. Oz, who's on television almost every night now, who is a medical doctor who's challenging the system of medicine, that there are other alternatives in this world. Great nutrition, great meals, and great doctors, great counselors out there that have a right to get into people's families and help these families be together, work together, get together, worship together, and basically get through life together with all these different alternatives. So we call this complementary medicine. That means, can you complement what somebody else is doing, a medical doctor or a clergy or a chiropractor, or what somebody else is doing with whatever you have? If you're at home and you don't have anything, you pray over a person. If you have great nutrition, use that. If you don't have anything else but a good drug, you use that. The bottom line is we have to learn as doctors and as patients, as people, that God entertained a lot of people, a lot of things, good things out there to help people get well. And so we're people of color. And so as a result, the body has its own way of answering and giving answers of things that we don't know, that it can reveal to us through the reflexes what's going on in that body. And so we can reveal pain. We can reveal fever. We can reveal the needs of anything that the body needs hormonally and nutritionally. And so we started teaching out our seminars that the body is a body of five. It just gave you the five systems of the body. See? And behind those five systems are five sets of teeth. There are five senses: seeing, hearing, tasting, smelling, touch. And the body is loaded with all kinds of fives that you can find in the body. And so we check the five senses. We check the five set of teeth. We check the five sutures that are on the head. And with all these different systems, that they're all congruent. You have five fingers. You have five toes. If you think about it, each one of those five fingers and five toes that are sticking out there are attached to each one of these five systems and five sets of teeth and five senses. And so when they're all working together and all their pulses and all their frequencies are equal, you don't disappear. Your body stays healthy. And so we show our doctors that come to our seminars how simple it is to check a finger, and if that finger's pulse is not a 10, that's what it's supposed to be. If it's less than a 10 or above a 10, it's because that finger is attached to an organ that's not healthy. And it's our job to make sure that each finger is equal, each system is equal, each tooth is equal. And this is a lot of fun as a doctor, because you're always finding things that make people healthier every time they come in. And of course, as a chiropractor, I use great chiropractic adjustments, and what an adjustment does is it steers the nervous system on to attach itself to the nutrition it needs to help somebody upright their body, remend their body, repair their body, and get well. As a clergy, you would pray over somebody, and the energy of prayer, meditation, is great healing to people. If you're a great medical doctor and you know great science, great drugs, that drug is always, all drugs are attached to nutrition. If drugs don't work, it's because the body is in malnutrition. If adjustments don't work, the body's in malnutrition. I tell people, you pray and meditate, and it doesn't work. You go to a chiropractor and it doesn't work. You go to a medical doctor, it doesn't work. You had better fill your gas tank of nutrition, because everything is attached in our body to nutrition. And so chiropractors believe that the body is emotional, that the body is energy, the body is structural. They all have to be balanced. And when we balance all these things together, people get well, they feel good. But when the body is sick and tired, the body subluxates. In other words, in chiropractic, we call that subluxation. The body holds that lack so it doesn't get any worse. So bones go out of place to hold up what's left of you. We call that the body's holding up the ugly, the lack, the deficiency. And so our job is to turn that around. Whoever we are, whatever God has assigned us to be a healer, our job is to analyze. Medical doctors diagnose, we analyze. We break parts of the body and try to figure out which parts are not equal to the other parts and make them congruent with each other.
Let me back you up just a bit. You started out by saying, and it intrigued me, and I've been hung up on it ever since you mentioned it, that a group of you, like what group, met a while back and decided that you were gonna put together a way to examine the body?
Well, first of all, we didn't have a name in those days. We just got together because we as doctors were already getting miracles of patients. As medical doctor did, I did, and other doctors, but we got together doctors that were interested in researching. You know, research means to search. You're actually researching. You're searching to find answers for things that people don't have answers. In this day and age, doctors are searching for answers for, say, Alzheimer's. They're searching for answers for kidney failure, for diabetes, for high blood pressure, for obesity. We have great answers for those things because the body will relate through a system called contact reflex analysis. You can go to the pancreas, it's a diabetic pancreas, and you can challenge that pancreas as to why it is a diabetic. And I find, not in all, but the majority of people that have pancreases that have gone bad, that are diabetics or living on low blood sugar, these people all have tired hearts. Most of them are born with tired hearts. And as a result, the heart is clanking so hard, it's so tired, it literally wears the pancreas out and become a diabetic. So do I manage the pancreas? No, I manage the heart that has wore out the pancreas. The heart is an organ that beats 100,000 times every 24 hours. You can't even count that many times in 24 hours without getting tired. 17 days after inception, your heart is already beating 100,000 times the rest of your life. You got to get tired just thinking about the job of the heart beating that many times. And so it's the job of all these different systems to keep that heart beating congruently, perfectly. I have a brother that's 93. I have a brother that's 89. I have a brother that's 87. I have a brother that's 80. And I have a twin sister that's 74. Our hearts have been beating since inception 100,000 times. These guys are healthy. They do things. They work because their little brother, Veresedaal, keeps their heart healthy. I maintain this. If you keep the heart healthy and the backups of the heart healthy, you'll keep living. You know, in Bible times, they lived 300 years. Methuselah lived 900-some years. Why can't we live that long? And I believe we can live well beyond 100 years of age with today's science. We have a lot of new science out there that helps doctors keep people well. So, yes, we developed a research group that literally took blood tests and urine tests and cardiographs and x-rays. We did everything with each patient. And over a period of many years, we had 8,000 patients. And we got like an 85% result that was proven through the University of Michigan and the University of Arizona with all these doctors. And so we developed a group, we called that CRA. And all these guys got together, these doctors got together, and we had conventions, and we had seminars, and hundreds of patients would show up at each seminar. We used to have 500, 1,000, 2,000, 4,000 sometimes show up. People would come, doctors and their people and their patients, and we would teach this to them, and we still do this today. All over the United States, like I say, I was with a group of 2,000 doctors this weekend speaking to these doctors, and they just listen, and they dream of all these beautiful things they can do for people. Miracles are being done today with great science, and these scientists are chiropractors, they're medical doctors, they're clergy, they're nurses, they're massage therapists, they're people that are working so hard to develop good answers, honest answers that are creative, and answers that are cost affordable. We're in a world today where it's not affordable to get sick. You go bankrupt the moment you get sick. And so we have answers that are very affordable. But I believe that the audience should know that once you go to a doctor that does CRA, you must be determined to maintain your health. Just don't try to get fix and repair and patch a hole in a road. I tell my doctors that the road to wellness is a toll road. And once you get on a toll road, they pave that road ahead of you. Keep that a beautiful road, a safe road. But it costs money to be on that road. But it's safe. And so we teach our patients that there are certain things that you need to keep your heart healthy, your thyroid healthy, your adrenals healthy, your kidneys, and your pancreas. And the average patient has to take 3, 4, 5, 6, 7, 8, maybe 9 different things a day that are very cost effective, they're very reasonable, to maintain your health. That's what I do with my brother. They're in their 80s and 90s, they're healthy, they feel good, they work, they bless, they enjoy life because we maintain their body. It's like a car. Car has to have oil, antifreeze, gasoline, windshield wiper solution, air in the tire. That's maintenance. But if you don't maintain your health, you're going to doctors just to get relief of pain and emotions and depression and high blood pressure and diabetes and Alzheimer's. That's not the way you should go. You should go to a doctor and say, look, this is what you need the rest of your life to stay healthy, And that's something that we teach our doctors that's very important. That way you don't waste away. You're determined to tirelessly make sure that you accelerate your body, enhance your body, don't let it disappear. Now, that's a long paragraph, isn't it, I just gave you?
Well, I've been intrigued by the opening salvo here, and it is of such interest to me as a clinician to see that you had a mission, and you found a group of folks that thought alike, and that you, based on I guess, the perception of the importance of the energy. I think the tie-in to the acupuncture was maybe the foundation that you used and pursued it to try to figure out how maybe you could take this ancient art of the way energy moves throughout the body and be able to assess it in a way that had never been assessed before. Is that a fair assessment of what you did?
Yeah, well, I believe we're all artists. You know, science and art, work through your hands. The school teacher works with kids' minds, and the doctor works with the patient's soul and with their spirit and with their heart. We all are assigned in life to love people, to spirit people on, to get them through life. And, the highest frequency of health in the body, I mean, frequency is energy. The frequency has to be promoted like rungs on the ladder. The higher the ladder you stand on, the farther you can look all over the world and the more things you can see. When people are sick, they're on the bottom of the ladder. They don't see much. All they see is just what's on the bottom of the ladder. And so each doctor owns a rung to the ladder. And sometimes we move people from one rung to another. And we share that patient who's on that ladder with various experienced doctors who are medical doctors, chiropractors, massage therapists, dentists, and psychologists, and everybody who has to learn and find and advance and research and find ways. And that's what CRA is about. CRA is not chiropractic. CRA is owned by God. CRA is owned by all the professions. And what CRA does is it accumulates all great information that all doctors have and all scientists and all great nutrition everybody has, and uses it to help people to get through life. And so basically, we are assigned as doctors to help people, help their families, to make sure that everybody gets through life working, spirit on, and just know that God is in their heart and God's going to motivate them and help them get through life. And so the top rung of the ladder is love. We say there's not another frequency that's higher than love. And if you can love your patient where they're at, when they're angry, when they're tired, when they're crabby, and they can hardly get along in life, that's a big job for a doctor. Because doctors sometimes get tired. And so you teach doctors, you tire less. Don't let your patient ever tire you out. Always be there for them, 7 days a week, 24 hours a day. And so it's a great job to be a doctor. You have to awaken people. You have to stimulate their brain and their heart. You have to rejuvenate them. And you have to make physical changes. You have to give them vigor. You have to give them creativity. You have to give them reasons to be fulfilled and experience every day a new life, like an Excelsior, what it is. And so, there's an old saying, if God didn't make it, don't take it. And we as natural doctors, we believe that drugs are wonderful, but if you got to live on a drug the rest of your life, that's a chemistry that's not natural. And so, biblically, there's 1,100 some different places in the Bible that it talks about nutrition and herbs and nutrition. And I come from a big background because my father was a businessman. He had a shoe store, and he had a medical doctor who was an Indian medical doctor, and they got together, and they were friends, and they studied herbs. By the time I became a doctor, my father had smarts in this stuff, was helping so many people, they called him doctor. And so I started out many years ago using herbs and oils and essential oils, which was around for thousands of years. The first doctors were clergy, and then they were the Indians, and they were all kinds of people that knew the ground and knew the soil. And so for thousands of years, your acupuncturists and your clergy and your scientists in those days, it's only been about 150 years that we've had drugs in this world, in this country. And so the world is going back to herbals and to the soil and to good nutrition to help people stay healthy. So our bodies are humans. They're called human beings. Human beings. We come from the soil. If you're not happy with your soil, we have great science today, great stuff that comes from the soil to win people's bodies back. See? And so I have a lot of things that I'm going to share with people this weekend, Saturday and Sunday in Harrisburg. teach these doctors great science that makes it easy for people to live long and live strong and be healthy. I'm 74 years of age, and I've got a body of a 28-year-old. My flesh and my skin and my organs are all healthy. I still have my original teeth in my mouth. I haven't seen a dentist in 20 years. That's how healthy my teeth are. And so the bottom line is that we teach people how to live and how to live healthy emotionally. Because your emotions can ruin your health. If you're not happy, you will ruin your health. If you're not happy, you will get Alzheimer's, you'll get cancer, you'll get diabetes, you'll get horrible things because the Bible says what you think you become. And so we teach people to be happy, to fulfill in life, and be happy and spirit other people on and bless other people. That's what God's will should do. So you got me going here, Doc.
Oh, I do got you going, and anxious to hear too that you're coming. You must have a group of docs or practitioners of various kinds that you're going to be teaching this skill to in Harrisburg. You've taught so many others already. That's why I know so much about you, because of your previous students who speak so highly of you. Now, when you come to Pittsburgh on Thursday, and you're listening to a group of people who are listening to you now that aren't necessarily docs, although there are many of them out there who are listening, but to come up to hear you speak on Thursday night, what will I be learning? Will I actually be learning? Can I learn to do the rudimentary beginnings of CRA? Will you be able to teach me that?
We will share just simply and show simply how we test people. We'll take people out of the audience, not a lot of people, because when we teach this weekend, we have a 2-day seminar. We'll go through maybe 50, 60, 70 people and share what it takes to show get well, because it's very easy, it's very simple. It takes us about 1 minute to figure out what people need to stay healthy or get out of the problems that they have. So we have 7 reflexes on the body that we literally check. And those 7 reflexes will give us answers to almost anything that can be wrong with you and anything that we need to do to upright your body, get your body moving on. So yes, we'll have probably an hour and a half or 2 hours that we're going to be speaking to a big group of people. These will be doctors, and these will be lay people that are invited to come in. And I'm certainly you will do that on your radio today. You'll tell them where it is and where to come. And so, but this weekend, this is strictly for doctors. And so if there's any doctors in this audience listening right now, you want to call 616-669-5534 to make an appointment or register for this seminar that is Saturday and Sunday at the Radisson Hotel. And certainly if you call that number, Dawn Jose will register you for that seminar. Patients can only come if they come with their doctor and register through Dawn to come, because we can only take care of so many. Sometimes everybody wants to come, but we just can't do that. So, but yes, Thursday night, the public, I guess, is invited by you to come and listen, and then proceed, doctors that are in the audience or whoever is going to be there this weekend, if they want to choose a doctor, or we see when they still can call Dawn and find out where these doctors are, or call you and find out, okay?
So then, by going up to visit with you this Thursday, just as a layperson, you could expect to observe others being tested.
Oh, yes.
Others being tested through your 7 reflexes.
Yep.
You say within a minute, you can come up with some diagnoses as to what the root.
We don't use the word diagnosis. Diagnosis is a term owned by the medical profession, and I let them know we analyze. We analyze and we manage health. Medical doctors diagnose and treat. That's their legal right. But most of your alternative doctors, and there's a lot of doctors that are medical doctors that are alternative. We believe in the alternative field of healing, that it's proper to analyze the body, break the body's parts and analyze, find out where the root cause is. When you diagnose, you're diagnosing a name. You're giving a name for something. And so diagnosis doesn't always tell you root cause. And so I prefer to find the root cause of the reason why somebody has a problem than to diagnose. And so diagnosis is 50% wrong most of the time. And when you analyze something, you generally are right on. And so we analyze.
And you take up...
We manage the body that is sick. We don't treat cancer. We don't treat diabetes. We don't treat Alzheimer's. We manage the body that has cancer, diabetes, and Alzheimer's. And when we manage that body, we share that body with the doctors that are smart MDs and scientists, and scientists like Dr. Oz, and great chiropractors and massage therapists and nutrition. God has given everybody a hand in helping people live long. And I don't think that there's any one system or any one art that owns that body. The patient that has to own the doctor, not the doctor own the patient. The patient should have freedom of choice to go to their medical doctor, their chiropractor, their nutritionist, their massage therapist. And when man has the freedom of choice, that's when he's free to help his body, get his body analyzed, get his body managed, and manage his health. Because health is a manageable thing. You have to manage your health every day. You brush your teeth, you take showers, you take baths, you pray to God, you spirit your body on, and then, you believe that life is all about an assignment. God assigns you, He gets you through life, He takes you out of there. And if you do that, life can be pretty happy and pretty important, pretty wonderful. So we share things with people that God made, things that come from good soil, things that are natural and normal to the body. And yes, drugs are necessary if you get cut up and you get beat up and you get very ill and very diseased, very sick. We need medicine. We need good medicine, safe medicine. We work with medical doctors. When we use nutrition and give nutrition, it makes their work so much easier. We make doctors, medical doctors and surgeons look good by helping their patients nutritionally live in good wellness. And not every doctor has that. And so we teach our medical doctors and chiropractors and health care providers, we teach them great science, great nutrition. That's what Dr. Oz is doing on television now. Trying to tell people, find a doctor that knows nutrition, understands nutrition, and helps you absorb these drugs and chemicals and prayer and meditation and exercise in a proper way. So nutrition is so important to live long and live healthy. Okay?
Well, yeah, and so you can in a minute or so, I'm trying to gauge now, but you can assess someone's 7 reflexes, because I think...
Doctor, as fast as I say 1, 2, 3, 4, 5, 6, 7, I've already determined what's wrong with you. Okay?
Wow.
Okay? Then we take a few minutes to tell you what you need every day, breakfast, lunch, supper, or any time of the day, bedtime. There are certain times of day, because you have a 2 12-hour day. From 6 o'clock in the morning, 6 o'clock at night, your body is literally like a truck going through life, bringing things around. You're working. You're on the job. Women are working around the house, cleaning the house, doing chores, or they're at work, working behind computers. Men are driving trucks. They're mechanics. They're preachers or teachers. They're people that are just working all day. That's the job of your liver. Your liver is an organ that gets you through the first 12 hours a day. But after 6 o'clock at night, from 6 o'clock at night to 6 in the morning, there's a whole different group of organs that work. And the spleen is your organ that works at night to replace you, to repair you, renew you, take all the cells in your body and renew them again. We call that, your daytime organ is your liver. We call that your grocery store. Your nighttime organ we call your 7-Eleven. Your 7-Eleven grocery stores are all open at night. And so your spleen is 7-Eleven. Its job is to make sure that you are ready at 6 o'clock in the morning again to meet life, that your body doesn't wear out. So I teach doctors what people need the first 12 hours a day, then I teach them what they need the next 12 hours at night. So during the day is your working day. Working day at night is your body's ability to repair and remend and win back that body so you don't get a day older. That's what they do with toll roads. They make sure that at night you got lights and they're repairing roads and paving it ahead. During the day, you're driving on that road that's been well paved. So your body gets paved at night with special organs that rewind your body, winding up a watch, see? And so I'm determined that my body never wears out. I'm determined that I stay healthy and young. Scientists know that a healthy body should never get any older than 28 years of age. As a man, 24 is a woman. And I'm determined every day never to let my body be a day older than 28. And when I do that, if you see my skin, and you can see it next week Thursday, I have skin of a young person. And your skin is your biggest organ in the body. It's 36 foot long, and it's big inside and out. And that's one of the most disease things that people have today as they get older. They let their skin wear out. It's called your birthday suit. We believe in helping people keep that birthday suit healthy. And so there's certain nutrition that you need every day to stay healthy, to live long. Never let your body wear out. Stay young, spirited. So you don't get all these horrible diseases that people have today. All diseases All diseases, in most cases, are due to malnutrition, lack of nutrition. I don't care how rich or poor you are, there are certain things you're going to lack that are going to give you disease. A disease is nothing but lack of ease. When your bodies are so lacking of ease that it's an effort to get through life, you have some mal in your body. And we can tell within a minute or less what that is. And it's fun, because you never let people's bodies wear out. They stay young. They live long. They live to be 100 years of age and longer. And I can prove that. We do that every day, and I do that with my own family. And so hopefully a lot of people show up. And, they come there, and they enjoy it. And if there's any doctor on this line that wishes to come to the seminar this weekend, again, call 616-669-5534 or go to the web and go to www.crawellness.com. It'll get you information about us, what we teach, what we share. And so use products from a company called Veresedaal Products Incorporated. And so that is a product that is so wonderful. It's so natural. It's so God-made that when you get on these things, your body wins its health back very quickly.
Well, I see.
Reintroducing.com. Wish to know how these things are made. It tells you that. So you'll really have a great opportunity to win your health back and ask questions. Come there and learn what it takes to stay healthy. And there'll be doctors there of all professions that you can ask questions from. So hopefully this is helpful.
Well, I can see that you ultimately, with your request now for the practitioners who may want to learn the skill, and I'll give that number once again, ladies and gentlemen, 616-669-5534. If you are a clinician, a practitioner, and think you'd like to be able to learn the actual skill of CRA, but you, when talking about your Harrisburg encounter, mentioned a concept I had never really heard before. You say, hey, if you're a patient, the way you come is you have to come with your doctor. Like, you encourage pairs or pairings of clinicians coming with patients to your seminars. Now, that's a new concept.
Well, not for us. We've been doing that for 52 years already. And we've been doing that. We, like, this weekend with 2,000 doctors. I mean, some of the doctors brought their patients. They even bring dogs and cats. You know, dogs and cats. There are 58 million dogs in this country and equal that amount of cats. And they're our friends. They share our life with us. And God made them to make us happy. And so animals are beautiful. And they take on emotions. They take on diseases. So at our seminars, people sometimes bring in their animals. And, of course, I'm on the phone every day with veterinarians. I'm very close to a lot of veterinarians, very famous veterinarians. And so vets are very interested in nutrition, and they use nutrition to help these animals get well. Animals respond so quickly with nutrition and with essential oils. So we teach this on our seminars, how to manage animals, how to help animals get on, how to help them. Because they're emotional. They're very emotional. If you think you're emotional, they're very emotional. They're in the business to love and attach, to give and to share. And people have a great time with their animals. So cats and dogs and birds and all your horses and animals out there, I mean, goats, these pets are wonderful things. And so doctors call me every day on animals, and I give them wonderful answers for these animals. If you're a doctor and you're a CRA doctor, you have the right to call me any time of the day on a patient and ask for answers, because I have answers. I've been doing this stuff for 50-some years. And I've gotten a lot of smarts from many great mentors in life, and so I usually have a great answer that always works. Beautiful thing about nutrition doesn't hurt you. It can only help you and bless you. And we use the best of science that God makes. That's in nature. So I encourage doctors that are listening to get there Thursday night or get there this weekend and learn something beautiful, because you will.
Now, if they come, Dr. Veresedaal, if they come, can they expect in a 2-day seminar that you're going to have to be able to leave that seminar and be very proficient with CRA?
Oh, yes. We take these doctors and we train them. We actually stand them up and they each pair off. They pair off with another doctor, and they get trained how to examine, how to test. And every doctor is tested for their own health. We want to make sure that every doctor leaves that seminar with answers to stay healthy, because I believe a doctor that is healthy can teach other people to be healthy. If you're a doctor that's obese, or you're sick, or you're tired, or diabetic, or you get tired at the end of the day, you're not going to be able to help people move people on. got to be a person that is like a refrigerator, that you're attracted to get the refrigerator, see? The most attractive thing you have in your house is your refrigerator. That door is open more than any other door in your house. Well, a doctor, to open doors to help people healthy, has to be an attractorship. He has to have smarts. He has to have a certain amount of genius. We tell our doctors, when you leave this seminar, you better go home with some genius and learn to be a genius, because those are the people that move this world. And so we work tirelessly every day to find answers for all these different things. And today we have a world of great scientists that are inventing great things that help people get well. And so we teach this. We train our doctors. We stand them up. We pair them off with other doctors and pair them off with more. And we want to make sure we have doctors that are highly experienced, and they watch them and they check them, we train them, we watch them, and by the time they leave, they have a good start. Then we have training DVDs. They have 9 hours of DVDs that they can take home and they can train. We have wonderful notes and books and papers on almost every disorder known to man that they can look it up and get answers, and they can call us. And so we're there for them, believe me. And so we go to the colleges and we teach this, and the colleges hire me. I'm hired by college and universities. Even medical universities have me teach this stuff for them. And so it's wonderful stuff. Everything that God made is a gift to us to steer people on, to give them a long life. And it's all about loving these patients and making sure that they're loved. A lot of people have had hurts and emotions and losses in their life. And we have to change their life and steer them on. And just like I bring all my clothes to the dry cleaners today after a long weekend. They clean them and they perma-press them. This is what we do with you. We clean up your emotions in your life, and we perma-press your body, and you stay young. If you look at my brothers that are 8 or 9 years, they're kids. They're young. They enjoy life. They love. They absolutely enjoy blessing other people. They're laughing. They're smiling. They're talking about God, and they are out there, and they have a great time every day. And that's what we all should do.
Well, Doctor,
life is motion. That's called active fitness. Life is emotion, active fitness. Okay.
I'll tell you what, if there's anything that rings true for our discussion today, energy spills off of you. Your energy level is palpable, even over the airways. I'm sure people are going to enjoy up there, folks. He's going to be up at Butler, Freedom of Choice and Cancer Therapy Group on Thursday night. You'll want to be there. Dr. Veresedaal, it was a pleasure to have you with us today.
Thank you. You have a good day, and I'll see you soon.
Okay. There you have it, ladies and gentlemen. Dr. Richard Veresedaal. I don't think you want to miss this. We'll see you on Wednesday here when we're back. Until then, this is Dr. Dennis Courtney with Dr. Richard Veresedaal saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group.